Today we will talk about sports injuries and specifically knee sports injuries. We have all heard a lot about sports injuries. So if you define sports injury, that means any injury which can occur during sports or sports resembling activity. Sports resembling activity means injuries that occur during sports activities. Like you must have heard, sometimes two-wheeler accidents, sometimes slip of foot from stairs. So any injury where your ligament or muscles are injured, they are typically known as sports injuries. Some challenging sports like basketball, football, cricket, volleyball, these have more sports injuries. Sports injuries are very common in wrestling. So today we will talk about knee sports injuries. So to understand knee sports injuries, first we should know what is the normal structure of a knee joint. So here is a model which will help you to understand knee structure better. So you can see, this is the thigh bone, we call it femur. This is the leg bone, we call it tibia. And these structures, these are elastic-like structures known as the ligament. Similarly, inside the joint, we have two ligaments. This is the front ligament, known as anticruciate ligament or the ACL. This one is the back ligament, known as the PCL, postacruciate ligament. Apart from that, this is a smooth structure, smooth covering over the joint, over the thigh bone, known as cartilage. This is the smooth covering. And inside the joint, you can see, this is a C-shaped structure, this is a cushion-like structure, known as meniscus. So commonly, the sports injuries in the knee are the ligament breaking or the fracture of the leg. Now the question is, how is the ligament injury? So you must have seen, if your leg is stable and the body is rotating in this way, then this elastic structure, which is known as ligament, can be stretched up to its maximum limit. If the stretching is more than the maximum limit, then the condition is known as ligament tear. It means, if the elastic is pulled more than its capacity, then this is known as ligament tear. If you get a very big swelling on the knee as soon as you get injured, as we see in this photo, so this is a very alarming symptom. If you see so much swelling in this joint, then you must have a query in your mind, that this can be a suspected ligament injury. If you try to stand immediately after the injury and you fall, so this is almost always confirmative of a ligament injury. Like you got hurt, you fell, and you tried to stand again without any support, and you were afraid of falling again, you felt that your knee will come off. So this symptom is a very alarming symptom. Excessive swelling, instability, these are common symptoms of ligament injury. Apart from this, whenever twisting occurs, then in your thigh, which is known as the cushion of the joint, there can be an injury. Now, along with ligament injury, we should also know what are the symptoms of meniscus injury. If you feel something stuck in your joint, you feel that you are trying to straighten your knee, and it is stuck, locking, the symptom is known as locking. So if locking is there, then this symptom is almost always confirmative of a meniscus tear. So far we have understood that whenever excessive twisting injury occurs due to any reason, due to sports or due to an accident of our denture, excessive twisting injury occurs, then there can be an injury of ligament or meniscus. If this is a symptom of instability, means your foot falls at any point and you feel a shiver, then this symptom is a typical symptom of ligament injury. We should never ignore such symptoms. Thigh being thin, this is an indicator of ligament injury. Where we do not pay attention to ligament injury in the beginning and keep pulling it for a long time, then in those cases, the symptoms like scratches also start coming in the joint. And you assume that even young age players or young age people also start getting old age symptoms in their knees. So the purpose of telling you all this is that whenever ligament injury occurs, we should take it very seriously. If we talk about partial ligament injury, then partial ligament injury means if the ligament is damaged in a small area, then we can recover from that pain through some exercises. If the ligament is completely broken and we get shiver symptoms again and again, then its treatment can be done by a joint disease treatment through a Durbin, i.e. through arthroscopy. Arthroscopic results are very good. More players can resume their sports career from that. Similarly, if there is a minor injury, then we can treat it with some medicines. But if there are symptoms like locking, then it is either repaired with arthroscopy or the broken part of the ligament can be removed and treated. So far we have understood how sports injury, ligament injury, and meniscus injury can occur in the knee. And what is their primary treatment and what treatment we have to do in the future. There are two more important things that we should understand. If there is such an injury in any sports field, then what should we do? So there is a defined protocol for that. We call it RICE protocol: rest, ice, compression, and elevation. So whenever there is such an injury in the sports field and there is so much swelling, then never massage it. There should be no warm application on it. We should do ice compress on it. We call it ice compression. In this subject, we will talk a little more about some common questions and answers, some myths. We will talk a little about them. The first thing is that how many patients ask that, sir, ligament injury is a complete ligament tear, so can it be cured with physiotherapy or not? So today I want to clear this thing to you that the ligament can never be joined with physiotherapy. As I told you in the talk before, if there is partial ligament injury, that is, some part of the ligament is damaged, then those muscles that work like a ligament, that is, if your anti-occlusive ligament is damaged, then if you give strength to the muscles behind the hamstring, then they can support the ligament. But that does not mean that physiotherapy can heal that ligament. Similarly, if there is a complete ligament tear, then no kind of physiotherapy can help it. Therefore, the decision of ligament injury should be very balanced. If there is a partial ligament tear, you are not a very big sports person, the knee demand is not so much, then physiotherapy can help you. In that case, we should not go for a serious surgery. On the other hand, if the ligament is completely injured, then physiotherapy should not be done in it, otherwise we can get damaged in the joint. The second question is that patients ask us that how much % recovery will be there in this, what is the guarantee? So today I want to make it clear to you that there is never a guarantee of any surgery. Surgery is always to recover you from your existing condition. So, with surgery, you go in a very good recovery, go ahead, the joint becomes stable. And it can only be said that many famous people have had ligament injuries, sports injuries of the knee, and they have recovered it very well. You must have heard the name of Yuvraj Singh, he has had a ligament injury in his knee. Tiger Woods, who is a very famous golfer, has had an anti-crochet ligament surgery in his knee. This is very common in football. A very famous footballer has had a ligament surgery in his knee. And they resume back to their sports again after these kinds of surgeries. So, in this talk, we will be talking about common questions that patients ask us, that what happens in arthroscopic surgery, how it happens, how much stay is there. So today we will talk about all those things. The first question that is very common is that how is this surgery done? If I talk about two common surgeries, one is ligament, anti-crochet ligament, and the meniscus. So, anti-crochet ligament, as we talked about in the last talk, whenever excessive stretching, excessive twisting happens, excessive stretching of the ligament, then the ligament is pulled more than necessary and gets damaged. For example, if we pull the elastic more, it becomes useless. Similarly, when twisting injury occurs, then this injury can be caused by overstretching in the ligament of the knee. And the result of this is that the ligament becomes non-functional. Medically, it is called ligament tear. Now what is the remedy? If there is a complete ligament tear, then the surgery would be arthroscopic ligament reconstruction. MATLAB will ligament repair nahi ho sakta hai, hum usi reconstruct karna patta hai. So what we mean with reconstruction? Reconstruction means aapki sharir mein aisi manspeshi leke uska ligament baneg, purane ligament ki jaga pe usko lagaya jata hai. So the procedure is known as arthroscopic ligament reconstruction. Or ye jo pura surgery hota hai, ye durban kumadad esi kia jata hai, arthroscope esi kia jata hai, jis ki joint ko uzmi bahut sayata koln ka zararat nahi patta. Surf to ya 3 holes se surgery ki ja sakti hai. Dusri bat ism hum lagan se puchi jati hai ki ism jishi kism ka koi implant lagaya jata hai kia. To iska jawab hai yes, of course use implants for that. Or wa implant do tera ku hota hai, ek to uzmi button hota hai jo ki thigh bone, yani femur ki taraf lagaya jata hai, or ek screw hota hai jo ki generally absorbable hota hai, matlab wa sharami pegal kukatam ho jata hai. Ye implants ka upiag hum log islai karti hai ki jo ligament, matlab mon speshi ka jo ligament hum opki sharami lagaya hai, initially union hon tak wa apni jaga pe istirahi. Union se humara matlab e hota hai ki jab hadi se usi ligament mi circulation shuru ho jata hai, matlab hadi ek tera se usi ligament ko pakad leti hai, to a ligament ways act karta hai jaisa ki humara previous ligament the. To iska same sima kia hodi hai. Generally ek ligament ko samanya union mi 6 half to, yani ki 1.5 mon ka same lagta hai. 6 mon mi strength iski bati hai, or 10 se 12 mon mi strength mi or zyata but hotri hodi hai. 2 as per standard protocol of a ACL, anti-cruciate ligament surgery ku bad ka ek jo samanya protocol hota hai ki 6 half to tak humko brace band kurakna hota hai, 6 mon halka sports ain mi lagta hai, or football jisa sports kuliya hum lagbak 10 mon ka samaism lagta hai. Yi iska samanya protocol hoda hai. Exol or humspar bar patients could dwara pucha jata hai ki jishi physiotherapy ku ism avashyakta paddi hai kia. Yes, of course, ism ek physiotherapist ka bahut important role hoda hai, or sahi tari ku se physiotherapy ism hona atyadik avas hai ak hoda hai. Day 1 se hai physiotherapist could dwara apko gutna 0 to 90 degree tak ism mod dia jata hai, or apko first day hai kata karka walker kusahata se kalaya jata hai. Hala ki protocol standard nahi hoda hai, ye patient to patient vary karta hai, or depend karta hai ki yadi ligament kasath main meniscus kabi surgery hoda hai, ye 2 ligament ka surgery hoda hai, to ye protocol mi thoda sa variation hoda hai. To ek jo common question hoda hai ki post-operative, MATLAB surgery kubad mi kis tera se kia hoda hai, to peli sol ye hoda hai ki surgery mi kitna same lakta hai, ot mi kis tera se rana padda hai, uski bad mi kia, kaha pe shifting hodi hai. To peli sol jo ki bahut common hai, surgery mi kitna same lakta hai. To arthroscopic ACL reconstruction ek bahut lambi surgery nahi hoda hai. Generally surgery takes around 30 to 40 minutes in normal procedure, but kahi bar kuch challenging cases hoda hai asmi isi zyada same bi lakta hai, but overall OT time is say 2 to 3 hours, kyunki surgery se kuch same peli patient ko ot mi liya jata hai, preparation ki jati hai. Surgery kubad be dressing karn kubad hai, puri tera se normal hone kubad patient ko ot se shift gaya jata hai. So this entire procedure may take around say 2 to 3 hours. Generally ye jo surgery hodi hai, ye do ter ko anesthesia mi ki jati hai, ye to spinal anesthesia hoda hai, MATLAB op ki kamar se nich ko his ko sun karka ye surgery ko ki jata hai, is tera ko anesthesia mi patient awake hoda hai or unka surf nich ka his sun hoda hai. Dusra kuch patient mi kahi bar puri tera se unko bihash karka, jisa hum general anesthesia kate hain, usmi ye surgery ki jati hai. Surgery kubad mi lag back 2 gant patient ko recovery ICU mi rakad jata hai, jis ki jo unko post-operative discomfort hai, uski doran unka vishesh dayan rakad jaa sokt hai or waha pe special equipment hodi hai, extra care hodi hai, jis ki post-operative patient ko hum log specifically vishesh hup se hum unka dayan rak sokt hai. Dugant kubad mi jab humare patient thoda samami ho jata hai, unko thoda se pain kem ho jata hai or with thoda se comfortable position mi hoda hai, tab unko respective ward ya room mi shift kia jata hai, jaha pe trained duty resident unko care kardi hai or zeraret parn par consultant yani ki hum log jo surgery kardi hai, unko bi waha pe akia humare patient ko hum we take care of them. Peli dinyani ki j's aaj surgery hui hai to kal wa patient ka dressing hoda hai, MATLAB jo bulky dressing hai usko hata kubilkal patli dressing kar di jati hai, unk joint mi ek drain dala jata hai, drain MATLAB ek tube dali jati hai jo ki surgery kubad nikalni whale dandev kun ko drain out kardi hai, toas drain ko nikal dia jata hai, peli din dressing ko bilkal patla kar dia jata hai or yadi surgery surf anti-cruciate ligament ko hui hai to adhictor cases migan ko 0 to 90. Degree MATLAB 90 degree tak moda jata hai or weight dalki kata karka unko kalaya jaa sakta hai. To ye peli din ka protocol hoda hai or yadi patient ye ser kam properly kar leet hain to next day means day after the surgery next 2 days after the surgery patient can be discharged in normal course but ye discharge depend karta hai ki apki present condition kia hai aap kitna pain free hai so I can say 90% of the patient of anti-cruciate ligament surgery they can be discharged after 2 days of their primary surgery. Absol ye at a high key jab aap yaha se discharge hok jate hain to apko kin cheesan ka dayan rakna chahi to peli bad jobi apko surgeon dora instruction dia jata hai apko yebataya jata hai ki apko pair pe pura vajan dalna hai, partial weight bearing karni hai or surf to touch weight bearing karni hai, gutna kais mordna hai, sahita se mordna hai yerbina sahita se mordna hai to in cheesan ka vishay shup se apko dayan rakna chahi. Apko apni dressing ko jishi bihalat main jila nahi karna chahi, brace kok apko nahi rakna chahi kyunki iski bear main hum log bahut clear or specific indication apko detain. Generally day 1 se high apko trained physiotherapist ko appoint karna chahi or physiotherapist or operating surgeon kubich main koi gap nahi rahi iski liya apko dano kubich main ek samwat istapit karna chahi. Kyunki kahi bar kia hoda hai ki physiotherapist apna ek protocol kalada hai jabki surgeon ko yapada hoda hai ki exactly apki ligament kukia astidi hai to dano kubich main ek samwad hamisha hona chahi. 10 to 12 din kubad main lag back tak nikali jade hain to uski liya apko hospital main dabara balaya jada hai, surgeon apko check kardi hain or apka physiotherapeutic protocol wahi rata hai jo ki apko day 1 pe bataya jada hai. Lag back 3-week PE jo apko initially long knee brace lagaya the usko hada ku short knee brace matlab chota pada laga dia jada high or apko stick PE shift car dia jada high. Lag back 6 half to PE yes air support hata dia jada high but please do remember when I am saying lag back that means this is not a calendar protocol. So this will depend on what kind of recovery you are having. Apka recovery kis terra se chow raha high. Yadi apka recovery dima chow raha hai toya protocol thoda sa extend ho sakta hai. Or uski bad main apko surgeon ku or physiotherapist ku nerdishan main hai aga ku kam karan chahi or opki physiotherapist ko hamesha surgeon se pooch ku hai aga ka koi step kalana chahi kyunki dano ku beach main jab bi koi gap hoda hai usi apko jishi kism ka nuksan ho sakta hai. Or sabs zaruri bot apko 2-wheeler kalana, tetsi se cdn pe kalana. Yes sports JC activities jab bi karni hodi hain apko apni surgeon se definitely connect karna chahi or uski permission se hi apko dabra ye activities karn chahi.